It's part 2 of the lower extremity in the muscle world here of chapter number 10. And we're looking at the anterior view here of the lower extremity, beginning just slightly above the pelvis with some of these muscles. Notice that while this is not an anterior muscle, we do revisit one more time here the quadratus lumborum, which is the posterior wall of the abdominal cavity. And then we do start with anterior muscles of the lower extremity. And what I've done here is I've put little letter A's in front of the grouping. And the reason I'm doing that is that ultimately the group innervated by the anterior, here we have anterior compartment. There's 3 of them on the thigh. There's an anterior, a medial, and a posterior compartment. The anterior compartment is innervated by the femoral nerve. Okay, so basically we're going to learn all of these muscles right here with the understanding that they are innervated by the femoral nerve outflow. Remember, here's an exception. Over here, the tensor fascia lata is a gluteal nerve outflow muscle. But right here, we have, take a look at this here, psoas major. Okay, so this is psoas minor. We're not learning that one, but we are learning psoas major as one of the muscle bellies that hooks up with this other muscle belly here called iliacus. And we get something called iliopsoas. Okay, the P in psoas is silent, so we say iliopsoas, and then we also say psoas major. Just as they're going over the brim here together, they unite with one another and go over the brim and insert onto the proximal aspect of the proximal aspect here of the femur. So the lesser trochanter is in the way back of the femur, and so this is where the iliopsoas is making its connection. Okay, and we saw that the iliopsoas actually began with the iliacus, which is coming from the ilium, and the psoas major, which is coming from mostly the lumbar vertebra, okay, actually from T12, including the lumbar vertebra, okay, and of course we're going to the femur, the lesser trochanter. And what does this do? We have basically flexion at the hip, okay, so prime mover of flexing. And as again I've mentioned to you, I prefer that they mention the joint rather than the body part that's moved. It is, of course, we're hooking up here to the thigh and we're bringing the thigh upward. And in order for that to happen, the hip has to flex. So anyway, so this is a femoral nerve experience. And this is considered all femoral nerve here, outflow. Okay. So here we are with the iliopsoas, just the way you like it. Now it is going on the medial aspect here, so let's check back just momentarily here for actions. And besides being the prime mover of flexion, it should also be engaged a little bit in lateral rotation, and they do indicate here that that's an aspect of it. So they're pulling this way, and basically the hip is turning this way a little bit. But mostly when you've tucked your toes under the couch or something and you're doing sit-ups, this is the muscle that's getting worked. You could also do jackknives, touch your toes over your head while balancing on your hips. Something that's fun to do. Anyways, we have another very superficial muscle here called sartorius. It's considered to have the fascicles and muscle fibers that are the longest muscle fibers of the entire human body. Some people have longer thighs than other people. and proportionately as well. So it can be quite variable, but generally speaking, this is the longest individual muscle of the body. Starting from the anterior superior iliac spine, the ASIS right here, notice that it shares this attachment site with the tensor fascia lata. So they're both coming from this anterior superior iliac spine. It comes down diagonally this way and it goes to the tibia. Now the deal here is that when you shorten this muscle and you bend the knee, what's going to happen is that it's going to help you get into cross-legged position. So it is referred to sometimes as the tailor's muscle. Tailors were people, at least in India, who used to sit near the street, cross-legged, leaning up against a building wall, inside usually, and taking on, how shall I say, garments for work. They would sew garments together and give them back to the customer right there on the street. So at any rate, this muscle got the name of tailor's muscle from that sort of situation. Okay, then we have another muscle that's quite proximal here that's called pectineus. Pectineus actually begins on the pubic bone right here, the superior arch here, ramus of the pubic bone, and goes medially this way down to the femur. It is sometimes penetrated by the obturator nerve, so it sometimes has dual innervation, but generally speaking, it's a femoral innervation for the most part. Okay, and then, so this is going to do a little bit of adduction, not a very great deal. It's not a very big muscle. We do have some really big muscles here, 4 of them in number, which accounts for the quadriceps. So most superficially is we have quadratus femoris. That's starting from the anterior inferior iliac spine. The deal is that we have 2 iliac spines, as we can see. Where can we see it? I guess we can see it right here. Here's the superior and here's the inferior. So there's a little bit of space in between. So the so this guy right here, the quadratus femoris rectus, I'm sorry, it's the femoris, it's the rectus femoris, I can say this, rectus femoris is starting at this spot right here and coming down and joining with the other muscles. Now here they've abstracted that, and underneath we can see the vastus intermedius, and then on either side is going to be the vastus medialis, the vastus lateralis. So on the medial side, medialis, and the lateral side, lateralis, altogether for 4 muscles. Okay, and the 4 muscles will come together in the tendon here of the quadriceps femoris, and then it's going to cross over the knee, and it's going to insert by the patellar ligament. In the meanwhile, we have something here called a sesamoid bone, the patella. Sesamoid bones are bones that develop from growth centers right inside of a tendon. So we have a number of these sesamoid bones. There's some in the foot near the great toe. There's a pair next to the thumb, one of the thumb joints. And here again we have a sesamoid bone. These are generally bones that help a joint maintain their position. So they're sort of like hardware right at the joint itself. Okay, so that provides continuity and maintains the place. So that's now every muscle of the anterior compartment. From this same view, we can view, with a little bit of help from other diagrams, we can view the medial compartment, and the medial compartment is innervated by the obturator nerve, and the obturator nerve takes care of all of these adductors over here, the most superficial of which is the gracilis. And then right next to the pectineus, which is anterior, we're going to be having adductor longus. And then if you were to squeeze between the two, which I think you can see over here, that they have actually transected pectineus. Just underneath pectineus is going to be something called brevis. So we have this guy right here, which is the adductor brevis. So adduction means bringing the thighs together at the hip. Okay, and then we have one really huge muscle here that's referred to as the adductor magnus, and you can see evidence of it, and even to the point where it needs a hiatus here for the femoral artery and vein to go down through and behind the knee. Okay, so that's the medial compartment innervated by obturator nerve.